Month of November is Diabetes Awareness Month. Roughly 30 million Americans have diabetes. That's nearly 1 out of every 10 people. There are two different and distinct forms of the disease. Eyewitness News reporter Jasmine Allen spoke with an endocrinologist from Slocum-Dixon Medical Group about treatment and prevention.
The sooner we jump on fixing the problem, the better off we're going to be. I think is a huge reason why this month is important.
Dr. Sloan, an endocrinologist at Slocum-Dixon Medical Group, says that it's important to bring awareness to diabetes, but not just during the month of November. Around 30 million Americans are living with the disease. There are two types of diabetes.
In people with type 1 diabetes, you go from having enough insulin to deal with sugar to having zero. So that's the reason people with type 1 diabetes need insulin to live. Type 2 diabetes is less insulin, but also something called insulin resistance, which just means insulin doesn't do the job that it should do.
Roughly 80 million people have prediabetes and are at high risk for developing the disease within the next 5 years. Dr. Sloan says lifestyle intervention is the first and best thing to do. That includes lowering your intake of sugars, carbohydrates, and adopting some form of exercise.
This can help prevent numerous health complications.
There's a lot of complications that come up with diabetes, type 1 and type 2, and the longer you don't treat it and the longer your body's subjected to high blood sugars, the more chance you have of developing complications. So complications are eye problems, kidney problems, heart problems, and nerve problems. So sugar affects a lot of things in the body, so the sooner we can hit it, the sooner we can reduce your risk of developing these bad complications.
There are 3 major warning signs to look out for: urinating multiple times throughout the night, getting very thirsty without a reason, and losing an unhealthy amount of weight without changing any eating habits. Dr. Sloan recommends taking an online assessment to see if you're at risk.
So you can just type in the search bar when you get to the American Diabetes Association screening, and they'll refer you to a test. It takes about a minute, and you may have a conversation after that with your healthcare provider, and that'll be a very important step forward to fixing the problem.
Reporting in New Hartford, Jasmine Allen, Eyewitness News, First at 10.